Happy Saturday, everyone. Welcome to our video on the Patient Care Technician or PCT practice test. This is Nurse Eunice. I look forward to working with you today, and we will get started in a few seconds. I see some of you all are already in the chat saying hello, so hi, Jason. All right, so here we go, everybody. Let's get started. Question number one. A patient with diabetes has a blood glucose reading of 55 milligrams per deciliter. What is the most appropriate action by the PCT? Is it A, document the reading and wait for the next meal tray to arrive? B, give the patient 8 ounces of orange juice? C, notify the nurse immediately and prepare a carbohydrate source? Or D, recheck the blood glucose in 30 minutes? And what do we think, team? And for those of you all who do not understand the difference between CNA and patient care tech, the CNA certification gives you the back knowledge. It gives you the core knowledge on how to take care of patients, while a patient care technician actually is the more advanced level. It's the person who works in the hospital. You're taught how to perform sterile techniques such as catheterization, also how to draw blood and perform EKGs. So PCT is a higher level CNA. All right, and so with that being said, revealing the answer in 3, 2, and so let's make sure I had it right. It would be C. I have the wrong letter there. It's C, notify the nurse immediately and prepare for a carbohydrate source. So I see that some of you all put B. Let me see what the response was for B. Whenever you have a patient with a low blood sugar, as a CNA, you can anticipate that the nurse is going to ask for you to get some type of juice, but you shouldn't get the juice without the nurse telling you to do so. Plus 8 ounces of juice is too much. Normally it's going to be 4 ounces followed by food that has a protein source, such as a turkey sandwich. So the correct response is C. I have the wrong letter there. A glucose level of 55 is considered hypoglycemic, which you all were aware. This requires immediate intervention. The PCT should report to the nurse, and then once the nurse gives her direction, provide a fast-acting carbohydrate if requested. Because remember, if the person's unresponsive, the nurse will not be asking a CNA to go get a snack. The nurse is going to start an IV and give dextrose or sugar intravenously. All right, let's see how we do on this one. All right, so if you're not aware, at Florida Training Academy, we've partnered with Career Step, and we offer online PCT classes for those who are in the United States. Financing is available, and you can get more information by visiting our website, which is fltraining.com, or to speak to a career advisor directly, you can call the number shown on the screen. All right, so question number 2. What should you do if a patient has a hairy chest before placing the EKG electrodes? And so is it A, place the electrodes over the hair? B, shave the hair where the electrodes will be placed? C, ask the patient to shave the hair later? Or D, apply extra gel on the electrodes? And there's a question in the chat asking if this test is for CNAs. If you are a CNA who desires to work in the hospital, then yes, this practice test is going to help you also. All right, so let's see what the answers are. Let's see what your responses are. All right, I see B's and I see some D's. So everybody, revealing the answer in 3, 2, and yes, you would be able to shave the chest. It is going to be B. Do not just rip the hair off. So you're going to have a small little shaver that you can use, and you can shave the hair to ensure that the electrodes are contact the skin, and that's going to help ensure an accurate reading. Question number 3, what might cause artifact on an EKG tracing? All right, what's going to cause that irregular, rhythm, activity? It's not the patient's heart, it's something that we may have done. So is it A, patient movement, B, incorrect lead placement, C, electrical interference, or D, all of the above? And you're welcome. All right, so Our patient's a little wiggle worm and you're trying to get an EKG. So everybody, revealing the correct response in 3, 2, and yes, Cosmic, yes, Marcia, it is D, it is all of the above. So there are so many factors that can cause artifact. So that's why we try to have the patients lay as still as possible. But what if the room is extremely cold and your patient's shivering? So keep all of that in mind once you are a PCT and you have to do these additional tasks. Make sure the room is warm, make sure your hands are warm, try to get the patient to stay still, and make sure you're not hitting the tubing or the wiring. And then also make sure that you have the electrodes in the correct position. And your hospital will train you how to do so. Question number 4, what is the first step in performing a venipuncture? So now you've been tasked with drawing blood. What's the first step? Do you want to insert the needle first, apply the tourniquet, clean the puncture site, or identify the patient? What do you do first? And we're going all the way to 25 questions on this Saturday. So thank you all for joining us. And looks like Immaculene and Marcia. Does anyone else have a response? We'll wait about 5 more seconds. In 3, 2, and 1, I see for 2, I see Felicia. And yes, you're right. You're going to identify that patient first. So proper patient identification is the first step to ensure the correct patient is being drawn. Question number 5, during a catheterization procedure, the nurse accidentally touches a non-sterile surface with her sterile gloves. What should a PCT do? A, ignore it as contamination is unlikely to cause infection. B, notify the nurse and assist in replacing the gloves. C, continue with the procedure and ensure sterile draping. D, ask the nurse to double glove and proceed. Yes, so you are part of the healthcare team. You're going to be in the room when procedures are being done. If you see something that is that could harm the patient, what must you do? I know this one's tricky. I don't see any responses yet. Revealing the answer in 5, 4, 3, 2, and you all are torn between double gloving and also torn between notifying the nurse. Look, you all, nurses are human. They make mistakes. So you're going to do B, notify the nurse and assist in replacing the gloves. And you could do it really nicely. Hey, Eunice, I see that your hand touched her leg. Do you want me to get you some new gloves? You just offer. Because, of course, if that nurse continues with the catheterization process and she has contaminated her gloves, she could be introducing bacteria into the patient, which could lead to an infection. So you're not doing it mean. You're just being very precise and exact. And she may say, oh, my God, I didn't even notice. Yes, get me some new gloves. So contaminated gloves compromise sterility. The glove should be replaced immediately to prevent infection during the procedure. Also, team, double gloving is never a response according to the CDC. So I know they may have done it during COVID, but if you ever take a CNA test, double gloving is never a correct answer. All right, so question number 6, how long should a tourniquet be left on a patient's arm? Is it 1 minute, 20 seconds, 2 minutes, or as long as it takes to collect the specimen? And this is totally off topic, but it's going to be about 20 degrees in Florida. So let me know where you are located and what the temperature is in your city or state. All right, everybody. Revealing the correct response. Let's see what we have. All right, so you all, yes, I see a couple of correct answers. So you can leave the tourniquet on for up to 1 minute. So a tourniquet should not be left on longer than that because it can cause hemoconcentration. So when you're trying to locate the vein, you can put the tourniquet on, and then once you locate or find a good vein, you can take the tourniquet off, get all your supplies, clean the site, and then reapply your tourniquet immediately before you attempt your venipuncture. But you're not supposed to leave the tourniquet on that entire time. So it's okay to release your tourniquet and put it back on again. Oh, Missouri 24. Kelly, that is cold. All right, so question number 7. A PCT forgets to document a patient's abnormal vital signs until the end of the shift. What is the potential outcome of late documentation? Is it A, improved patient outcomes, B, accurate reflection of patient care, C, delayed intervention and potential harm, or D, no significant impact on patient care? You forgot to document an abnormal vital sign. What is the outcome? And that is correct, team. I am so proud of you, Felicia, Merlin, and also Marcia. I see your answers. So, yes, you are correct. It is C. And the image I have here is of one of us nursing administrators writing you up. So, timely documentation is critical to ensure abnormal findings are addressed promptly, preventing adverse outcomes. So, you will get written up if you don't document. And of course, worse than that, your patient could be negatively impacted. So, make sure you communicate and document timely. Question number 8. A PCT in nursing school is asked by a patient to insert an IV without RN supervision. I mean, you're so good. You're like the best PCT there is. They know that you are in nursing school. And Marcia's like, hey, would you go ahead and start that IV for me? What is the most appropriate response? A, insert the IV since the patient requested it. B, attempt the IV insertion to gain experience. C, notify the nurse after attempting the procedure. Or D, explain that the task is outside of the PCT scope of practice. All right, revealing the answer in 3, 2, and so far, the only person that I saw got it right, it's 2 people, the Dynamic Trio and PK. You can draw blood as a patient care tech, but you cannot start an IV. So inserting an IV is outside the scope of practice for a PCT, even though you're in nursing school. If you're in nursing school, your clinical nurse, the nurse who oversees you during your clinical placement, she is the one you'd be starting an IV with. So at no point should you be starting IVs unsupervised, even if you are the best tech on the floor. Let that nurse get up and do her job so that you can do yours. All right, so anytime that you are a student, RM must supervise you. And again, while you're working in the hospital, you're not working as a nursing student. You are there as a patient care tech, and by law, you don't start IVs. All right, so make sure you know your state rules and regulations for your certifications. Question number 9. What is the primary purpose of a tracheostomy? Is it A, to provide nutrition, B, to deliver medications, C, to maintain an open airway, or D, to assist with nutrition? Tracheostomies. What is the primary purpose? All right, revealing the answer in 3, 2, and Aurelio and PK and Felicia. Yes, you have it. It is C. It is to ensure an open airway. So a tracheostomy is a surgical procedure performed to create an opening in the trachea, allowing air to bypass obstructions or assist patients with severe respiratory issues. Remember that if a person who has a tracheostomy goes into cardiac arrest, CPR with the trach would not be mouth to mouth or bag to mouth. It would be back to the actual stoma or back to the tracheostomy tube. So just keep that in mind. Question number 10. A patient's IV is swollen, red, and warm to touch. What complication does this most likely indicate? Is it A, infiltration, B, phlebitis, C, hypovolemia, or D, dehydration? Yes, we're teaching you these medical terms so you sound knowledgeable, so that you don't go up and say the wrong terms and everybody's looking at you like, oh my God, you went to YouTube University. So Immaculene and Kelly and Felicia, yes, it is phlebitis. That is right. So the answer is B. Swelling, redness, and warmth at an IV site are classic signs of phlebitis, an inflammation of the vein that must be addressed by notifying the nurse. That nurse is going to come in there. She's going to stop that fluid, discontinue that IV, hopefully elevate that arm, and if necessary, apply maybe a warm compress because that is definitely can turn into infection. Right now, it could just start off as irritation, but we want to make sure that nurse is made aware of it. And for those of you all who sometimes have confused patients, I need for you to listen to your confused patients because your confused patients may not be confused all the time. And if your confused patient is saying, hey, my arm is hurting, I need for you to stop, take a moment, look at the arm, because otherwise the arm could look like this. And you're going to feel like crap later because you never listened to your confused person who was telling you they were in pain. They may be confused about everything. I'm sorry, some things, but they may not be confused, all the time. So even a clock that isn't set correctly is right twice a day. So your confused patient may be correct about what they're feeling. I just need you to assess it. All right, question number 11. A patient with CHF reports sudden weight gain and shortness of breath. CHF is congestive heart failure. After notifying the nurse, what is the next step? So we have a patient who is short of breath. They've gained some weight. More than likely it's fluid weight, so fluid overload. Do you want to A, assist the patient into a high Fowler's position? B, encourage the patient to ambulate to improve circulation? C, provide a large glass of water to help flush excess fluids? Or D, document the symptoms and leave the room? Your job as a CNA and a patient care tech is so vital because the hospitals are understaffed and a lot of new nurses are training new nurses. So I need for my CNAs to be vigilant, to know what to do until that nurse gets into the room, and to know when to call the nurse. So the correct response for question number 11 is, and everybody has it, and your nurse goes, wow, applause. It is, hey, you're going to assist that patient into a high Fowler's position. Now, this isn't the best image, but it's the one that I found. This patient's kind of slouched. So if the patient had the strength, maybe put an extra pillow behind him or get another CNA to help sit him up some. But, this is better than laying flat. Sitting in a high Fowler's position can relieve shortness of breath and improve oxygenation because it's going to help force that excess fluid that is built up into the lungs, into the base of the lungs. The PCT should stay with the patient and monitor closely until the nurse can get into the room. All right, question number 12. What is the purpose of humidification in tracheostomy care? So what does that humidifier do? When a patient's asking, this needs to be humidified, what are they really saying? Is it A, does humidification provide nutrition? Does it B, assist with breathing? Does it C, deliver medications? Or D, prevents the drying of the airway? When a person is requesting humidified oxygen, or if you leave the trach collar off of the patient and they're breathing in dry air, what's going to be the outcome? Yes, Felicia, Kelly, Merlin, Longa, and Rahel. Yes, it is D. Look at these lips, you all. They're going to end up getting chapped like that, all dried. But remember, they have an open airway. They have a tracheostomy. We don't need that getting dried out. So humidification prevents drying of the airway. And when you see those trach collars, that is providing moisture, it's providing humidity. So make sure you put it back on your patient. Question 13, what should you do if a tracheostomy tube becomes dislodged? Dislodged means it comes out. What do you do? A, reinsert it immediately. B, call for medical assistance. C, leave it out and monitor the patient. D, cover the stoma with a bandage. And I know freaking out wasn't one of the options, but yeah, while you're, mildly freaking out, what are you doing? This is a lot. It's a lot. Your first time experiencing something like this. But if you chose B, yes, you're pressing that code button. You're screaming. You're getting that nurse in the room because we have to put that back in as soon as possible. And that's not something that a CNA or a PCT will be tasked to do. That would be a nurse's responsibility. So medical assistance should be called immediately if the tracheostomy tube becomes dislodged. There should be obturators and other devices at the bedside. There should also be an emergency trach that is one size smaller, so that if something does become dislodged, your nurse would be able to reinsert a new trach at the bedside. Question 14, what is a common reason for placing a gastric tube? Now, this isn't something you do, but you need to know why a patient would have it. Is it A, to administer medications, B, to provide nutrition, C, to relieve gastric distension, or D, all of the above? So you're working on the medical surgical unit today, and your patient has a gastric tube. What might be a reason that this person has a tube going into their stomach? All right, I see varying answers. I see a lot of D's, and you all are right. It is D. So it's all of the above. Gastric tubes can be used for all of those purposes because if someone's vomiting, we're going to, we can connect it to suction depending on what type of tube they have. And we can, instead of having the fluids come out their mouth, all projectile and just, everywhere, we can connect the tube to suction and then just gradually, slowly suck out this excess gastric secretions, etc. So it can remove gas, it can remove fluids. We can do the reverse. We can connect the feeding tube to it so they can get some nutrition. And plus your nurse can push medications through it. So the answer is all of the above. Question 15. A patient reports severe chest pain and their skin appears clammy and pale. Clammy is kind of sweaty. After notifying the nurse, what should you do? A, leave the room to obtain the vital signs equipment. B, retrieve the patient's medication from the bedside. C, move the patient to a different room for privacy. Or D, provide emotional reassurance and ensure the patient remains still. Severe chest pain. They're pale, they're sweaty. What do you do while you're waiting for the nurse to come? Yes, you have the right answers. It is D, I need for you to remain calm. You remain calm. The calmer you are, the calmer that patient will be. Let them know the nurse is on the way. And then when the nurse gets in the room, that is when you could leave to go get the equipment for the vital signs. Do not leave this patient alone because it could progress to cardiac arrest. So keeping the patient calm and still can help reduce cardiac stress while you're waiting for the nurse. And you can also ask the patient to practice some deep breathing exercises if it doesn't make their shortness of breath worse. Question 16, a patient's urinary catheter is not draining and the patient reports lower abdominal discomfort. What should the PCT do first? Is it A, irrigate the catheter with sterile saline? B, check for kinks in the tubing and reposition the catheter? C, notify the nurse and wait for further instructions? Or D, replace the catheter with a new one? What do we do when someone has a catheter that is not draining? All right, revealing the answer in 5, 4, 3, 2, and hold up. Looks like I had one person who had it. I do apologize. It looks like it's Felicia, and I can't see the other person. Nathara, you all. The first thing you want to do if a catheter is not draining is just make sure your patient isn't laying on it. Make sure it's not kinked. So the first correct response is going to be B. The PCT should ensure that there are no mechanical issues before notifying the nurse. If the problem persists, that is when the nurse should be informed for further intervention. Whenever you are assessing a patient's medical equipment, you start from the patient. So if a patient, if they don't have any drainage in their bag, or if there appears to be a problem because it's not drained in the urine, you start at their genitals and you trace that tube all the way down to make sure there are no kinks. So just don't start at the actual drainage bag and then try to work your way up. More than likely, maybe their leg is on top of the catheter, and you can use a securing device to make sure that that catheter does not go under that patient in the future. Whenever you are securing a catheter, it goes on the upper part of the thigh and not on the hip. And if you don't have any commercialized stabilizing devices like a stat lock, you can use tape. All right, so let's see what our next question is. We're on question number 12. Oh, excuse me, question number 17. So a patient with dementia becomes agitated and starts yelling at the staff and the other patients. Notice all of these questions are what should the CNA do first? Okay, because I need you to be thinking your answer for everything can't be to notify the nurse. If you notify the nurse for everything, the nurse is going to be like, oh my God, don't put me with her anymore. She doesn't think. So your patient with dementia is agitated and she's yelling. What do? Is it A, notify the nurse and ask for help to restrain the patient? B, leave the patient to calm down on their own and monitor from a distance? C, redirect the patient to a quieter area and speak calmly to de-escalate the situation? Or D, administer a sedative prescribed for agitation? A dementia person is yelling. What do you want to do? And everybody has it right. We never want to leave somebody who is upset alone, especially if they have dementia, because hey, they could fall, they can become upset. So it is going to be C. Let's try to redirect. Let's figure out what's going on. Miss Mary, why are you yelling? Can you tell me what's going on, Miss Mary? She did what? Oh, I'm going to solve that right now. Is there anything else you need, Miss Mary? So de-escalation techniques such as redirecting and calming communication are appropriate first steps. The nurse should be notified if the agitation continues or escalates. Your job as a CNA, as a patient care tech, is to use these soft tones like what I'm using right now. Because if everybody's yelling, if everybody's talking loud, no one's being heard. So I usually talk really low. Unless the person has a hearing issue, I'll talk really low to make sure that they know that I am not trying to escalate. I am trying to resolve whatever their issue is and that I am on their side. Our next question, team, is question number 18, and this one is a scenario-based question. You will not have too many scenario-based questions on your examination, but I cheat. I'm not just preparing you for your CNA or PCT test, I'm preparing you for nursing school. All right, so a nurse on a busy cardiac unit is caring for a patient who is vomiting. At the same time, another patient in the next room calls out, complaining of chest pain. What should the PCT do? So your nurse is caring for somebody who's vomiting blood, and now another patient has chest pain. Whew, this is a busy shift. Is it A, notify the nurse about the patient with chest pain and wait for further instructions? B, assist the nurse with the patient vomiting blood and ignore the patient with chest pain temporarily. C, immediately attend to the patient with chest pain, assess their condition, and inform the nurse. Or D, inform another staff member about the situation, stay with the patient complaining of chest pain, and monitor them until the nurse can respond. Ooh, what do you think? Yeah, this is going to happen. There may be two codes on the floor at the same time. What do you do when your nurse is busy? I'm seeing some correct responses coming through. And for everybody who chose D, you are right. Go find the charge nurse. Go find another nurse. Call the charge nurse because you can't leave your patient. But you have to inform somebody else so that they can go get another nurse to come in to assist you because you can't bother your nurse who's in there right now with a patient who's vomiting blood. So both situations are critical. And so the PCT should act as a team player by informing another staff member about the situation. More than likely, a nurse is going to be that other staff member, and ensuring the patient with chest pain is not left alone. Monitoring the patient for worsening symptoms and providing reassurance is essential while the nurse manages the first emergency. This ensures both patients receive attention promptly. So you're going to stay there until another nurse can assist you. And if another nurse isn't available, there should be a charge nurse, there should be a DON, but it's going to get taken care of. You just stay calm and your nurse will be there as soon as she can. Question number 19. What should a CNA do if a patient with a tracheostomy shows signs of respiratory distress? Is it A, increase the oxygen flow rate? B, suction a tracheostomy tube? C, call for immediate medical assistance? Or D, remove the tracheostomy tube? And the reason I chose this image is because, Lord, if all this happened on your 112-hour shift, this is going to be how you look. You had a patient who was vomiting blood, a patient with chest pain, and now the patient with a tracheostomy shows signs of respiratory distress. This is actually what a 12-hour shift is like in a hospital, especially if you're one of those just very eager people who want to work in the ER or the ICU. It is nonstop. So what do you think the best response is, team? And Felicia says, C. And so you are absolutely correct, everybody. The answer for this one is C. Anytime it's a tracheostomy and they have issues, you're going to get that nurse in the room. Stay with your resident, though. So you're going to call for immediate assistance. Immediate medical assistance is necessary for signs of respiratory distress. So get the nurse in the room. And my computer's going a little bit slow, so I do apologize if there is a lag. Question number 20. What is the first action a PCT should take if a patient begins to bleed excessively during phlebotomy? So you went in to draw blood on the patient and didn't realize that they had heparin IV infusing. That's an anticoagulant, it's a blood thinner. And now they are bleeding excessively. What do? A, apply a tourniquet above the site. B, call for medical assistance. C, apply direct pressure to the site. Or D, remove the needle and bandage the site. All right. Everybody has the right answer. You all are great caregivers, great lifesavers. So the first thing you have to do is stop the bleeding. So look, you're going to apply some pressure and then you can press the button and call the nurse. But I need for you to control that bleeding while you're waiting for the nurse to come into that room. So apply direct pressure. And then I have like the Coban. So once you use your 4x4 gauzes, you can wrap it with Coban. And the wonderful thing about the self-adherent tape is that it sticks to itself. It doesn't stick to your patient's skin because our older patients have really fragile skin that's easy to tear. And if you wrap that much tape around their arm, whenever we remove the tape, we can cause worsening of the bleeding because we can literally take their skin off if it becomes adhered to that tape. And I hope you're learning something. And if you are, give the video a thumbs up because we are on question number 21. What is a critical aspect of caring for a patient with a gastric tube? Is it A, monitoring for signs of infection? B, ensuring the tube is secure? C, checking for proper tube placement? Or D, all of the above? Remember, you're the PCT. You're going to see things. And if you see something, say something. What are you monitoring for when a patient has a gastric tube? Is it A, B, C, or D? And you all are everywhere on this one. All right, revealing the answer in 3, 2, and all of the above. Because if it starts to protrude, if it looks like, there's more tubing there than there was previously, that could be a sign that the tube has come out. So all aspects are critical in gastric tube care. Again, monitoring for infection was one. Let's see what the others were. Ensuring the tube is secure. So we have that tape there. Otherwise, when a person is turning, they can actually turn on that tube. They can disconnect their G tube. Or if they have fluids, let's say they're getting a tube feeding, when they turn on it, it can occlude it, or worse for you, it can disconnect. And now you have tube feeding all over the patient, all over the bed. And now you have more work to clean up. All right. And so our next question, team, is question number 22. Let's get you to the right spot. Too many computer issues today. There we go. Question 22. When performing phlebotomy, what should you do if a patient feels faint? A, continue the procedure quickly. B, have the patient lie down. C, offer the patient water. D, stop the procedure and call for help. So if you've never seen this patient before, if you don't know anything about this patient, hey, how are you doing? I'm Nancy. I'm your PCT today. I have an order to draw your blood. Is it okay if I draw your blood? Do your little hand hygiene, get all your supplies. Hey, do you have any problems? Have you ever had any problems when anyone draws your blood? Is there an arm that you prefer? Ask all those questions. And that way he can say, oh, yeah, last time I fainted. Or I bleed, so you can make sure you have enough bandages there. And so everybody, what should you do if a patient feels faint? You are going to do D. You're going to stop the procedure and call for help. Additional medical support may be needed to stabilize the patient. So think about the reason why you are even drawing blood on a patient in the hospital. You may be drawing blood because their electrolytes are out of balance. Maybe they're dehydrated. They have so many other medical issues. And so there is a possibility that the patient may faint, not because of your poor or your very good phlebotomy technique, but just because of their health conditions. Okay, so be alert, be aware, and just be prepared if it happens. Stop the procedure, have your gauzes there, and you can resume after the patient is stabilized. Question 23. A patient with a surgical drain is scheduled to ambulate. Ambulate means to walk. What should the PCT do before assisting the patient? Is it A, secure the tube into the patient's gown with tape or a clip? B, notify the nurse and then ask them to secure the tubing? C, remove the drain tubing entirely to prevent dislodgement? Or D, ask the patient to avoid movement until the nurse addresses the tubing? Yes, Kelly, they don't call you a CNA in the hospital. They'll call you a patient care tech, and patient care techs can perform phlebotomy. They can insert urinary catheters. They can also do EKGs. Just depends on the facility and what the facility's needs are. But again, they do not start IVs. So that's a nurse's practice. That's a nurse's job duty. All right, everybody, revealing the answer in 3, 2, and yes, it is A. You just want those tubes just hanging. Y'all, we have little pins everywhere. So just make sure that when you put them back in the bed, you take the pin out. Otherwise, when they roll over on their gown, the pin could actually, be unleashed and it can actually stick the patient. So securing the tubing prevents accidental dislodgement during ambulation and is within the PCT scope of practice. So the nurse should still be notified if the tubing appears damaged or improperly placed. But yes, you will usually pin up those tubes. And if you don't know how to pin them, just tape them up. And before you get the person out of bed, just ask the nurse to come and check to make sure that she feels that this is secure enough, because you're going to be walking with this patient and you don't want that tube to fall or to pull on that patient's surgical site. Question 24, a PCT notices that a patient's wound drainage from a JP drain, and you'll see that on the next page, has changed from clear yellow to bright red. What is the most appropriate action? A, empty the drain and record the output as usual. B, reposition a drain tubing to ensure proper flow. C, notify the nurse and continue monitoring the patient. D, flush the drain with saline to clear any blockage. Now, what do you know about color changes? When something goes from clear yellow to bright red, what does that indicate? Is that something that you can, maybe document later? Or is that something you need to communicate ASAP? All right, revealing the answer in 3, 2, and yes, it is C. So that is a sign of active bleeding. So this is an example of a Jackson Pratt or a JP suction bulb. And so what will happen is these will be placed during surgery. And then gradually throughout the shift, it's just going to gradually suck or evacuate whatever drainage or blood is within that cavity. And so your job is to empty this whenever it's half full, but you're also going to be monitoring to make sure that if there are any changes in the color, or if you're emptying this 3 times in your one shift, your nurse won't know if you won't tell her. So if you don't tell her, she doesn't know that, wow, this patient has more blood being evacuated than normal. So usually you may empty this maybe twice per shift, but anything more than that, please let your nurse be made aware of. So going back to our best response, which is A, a sudden change to bright red drainage could indicate active bleeding, which requires immediate attention from the nurse. All right, team, we have did it. We are on question 25. A patient, again, we're on our surgical patients. I probably need to do a whole nother video on surgical patients. So a patient has a Jackson Pratt, that JP drain we just saw, in place, and the bulb is fully expanded and filled with drainage. What should the CNA do first? Is it A, notify the nurse and document the finding? B, compress the bulb and reapply suction? C, empty the drain, measure and record the output, and reapply suction? Or is it D, ensure the tubing is not kinked or obstructed, and then notify the nurse? Now, you have made my heart smile, young lady. All right, so I'm trying to show it. All right, I am so proud of you. Good day, Nurse Eunice. I passed my CNA exam for the first time I wrote in New York. My questions were all similar to ones I found in your live videos. Thank you so much. You are so welcome. I am so proud of you, and congratulations. What a way to start the new year. All right, team, let's see what we have for question number 25. Revealing the answer in 3, 2, and It is C. You have it correct, Longa. All right, so it's C. We're going to empty the drain, measure and record the output, and then reapply suction. So the rationale, a fully expanded bulb filled with drainage indicates it needs to be emptied and reset to maintain proper function. This action is within the PCT scope of practice. After completing these steps, the PCT should notify the nurse if the output is excessive or abnormal. And again, I want to apologize to you all because there's such a delay on my side. I can't really show some of your comments. But everybody, we have concluded our video. I am so proud of you. Thank you all for studying with me on a Saturday. Again, if you're interested in PCT classes, we have online classes that include an externship at a site near you. So even though we're located in Florida, if you're within the United States, you can take our PCT classes from anywhere. Just call us at 877-225-7151 to speak to one of our career advisors. And I see so many more people. Felicia has a test date coming up. Don't be nervous. You did so well on this test today. And you're very welcome. We are so close to having 1 million subscribers. Can you believe it? Initially, I was starting off. I've been creating videos for 12 years, but I keep them private so that only my students had access to them. And then shortly after the pandemic, I started making my videos public. So we're talking in less than 3 years, we have 850,000 subscribers on YouTube. So I need you all to keep studying, keep liking our videos, keep sharing our videos worldwide, because I am here to make sure that I help God's people take care of God's people, one CNA license, one nursing license at a time. And so I think that's my ministry, and that's what I was put on this earth to do. So I hope that you find what your purpose is, and I hope that I can help you not only find that purpose, but to help you share that purpose with the rest of the world. So everybody, I love you. Happy Saturday. Stay warm, and I will see you in the next video.